So the 5 why technique, this is also a problem solving method which explores the underlying cause and effect of any particular problem. Okay, so the primary goal here is to determine the root cause of a defect, an error, or a problem, because you are successively asking the question why. Okay, the number 5 why we use here, from all the previous times, everyone who has used this 5 why technique, okay, by asking at least 5 why questions, 5 iterations of asking why is sufficient enough to find the root cause. Okay, you don't have to use 6 whys, 7 whys. By fifth why question, root cause is evident to you. Okay, so in some cases it may take more than 5 whys. In some cases it may take just less than 5 whys. Okay, depending on the depth of the problem that you're dealing with. Okay, but on an average, by the fifth question of why, your root cause is evident. Okay, some problems are very small, very minute. Okay, by 3 whys or by 2 whys, you will find the problem. But in some situations, the root cause is very complex. So you may require more than 5 whys. Okay. So the main benefit of 5 why is it is one of the most powerful assessment methods of all non-statistical analysis. It can uncover and trace back to problems that were not very clear or obvious. Okay. And it is very simple. Everyone understands how to do it and it works majority of the time. Okay. It helps you to identify the root cause, understand the process. Okay. One process that can cause a chain of problem, determines the relationship between different root causes. More than one root cause you can find out of this technique. Okay. It is highly effective. You don't require anything that is complicated at all. Then when should you use this method? For moderately difficult problems, simple to moderately difficult problems, this method can be used. For more complex problems, you will require this method along with a combination of some other tools. Okay, just with 5 why you may not be able to understand the problem. In complex situation, you will require it along with some other tools as well. So this is about 5 why techniques. Then you have the scatter diagram. So scatter diagram, it shows you the correlation, relationship between A and B. Is it related or not? Okay, so for that, scatter diagram is used. Okay, it is graphical. You need a graph to use this. X-axis, Y-axis is required. So 2 data sets are required and you are trying to find out, is there any relationship between these 2 data sets? Okay. So usually the scatter diagram graphs, the pairs of numerical data is used with one variable on each axis and you look for a relationship between them. Okay. If the variables are correlated, all the points which you plot on this graph, they will fall along a line or a curve. Okay. And when there is no correlation, you will not find any scheme of all the plots moving in one direction. Okay. So first you have to collect pairs of data. Then you have to draw a graph of dependent variable and independent variable. Okay. Then you have to plot the points, okay, of the pair of data. And then you see where the points are moving. Is it going upwards? Is it coming downwards? or is it just scattered around? So in scatter diagram, if you see the first diagram on this left, if all the points are moving in an upwards direction, it means the variables are dependent on each other. If one thing increases, the other thing also increases. Okay. For example, smoking and lung cancer. The more you smoke, the more will be the risk of developing lung cancer. So with increase in the incidence of smoking, increase in the incidence of lung cancer, it's also seen. Both the side it is increasing. That is a positive correlation. Okay. When variables on x-axis are increasing, it will have an effect on y-axis as well. Y-axis will also increase. Then comes to negative correlation. When one variable is increasing, the other will decrease. Okay. For example, the more time you spend working out, the more weight you will lose. The more days you will spend working out, the more weight you will lose. So the time period of working out is increasing, but what is decreasing? The weight is decreasing. So on one area it is increasing, the other area it is decreasing. That is negative correlation. All the points are coming downwards. And the final example, no correlation, when the scatter diagram is just scattered around. Okay, there is nothing showing a positive or a negative correlation. You can't find a line moving upwards or downwards. Okay, everything is just scattered all around. You can't make any guess from this diagram. So this is a no correlation. For example, having apple on a daily basis and getting needle stick injury, no correlation at all. Okay, you have an apple on a daily basis or you do not have it. If you are not careful while administrating medications, you will get needle stick injury. Okay, so this is about scatter diagram. Then you have run chart. So in run chart, time element is important. Okay, over a period of time, a data set is observed. Okay, and that is plotted on a graph. So it is a line graph of data, run chart. And it is plotted over a period of time. You will collect data and put it on this chart over time. And then you find some trends or patterns in the way how data moves. Okay. They can show you, this chart can show you how the process is running. Okay. And usually it is a very valuable tool in the beginning of the project for control part and all. Okay, of Six Sigma methodology. In the control part, run chart can help you. It reveals some important information about the process. And it sends, it will set some controllable limit, etc. Okay, for example, in this chart, if you see, there is a peak point here, that is the astronomical data. Okay, something absurd has taken place here. Okay, this is a shift. Shift is everything is moving up and down around about 6 points up, 6 points down. Okay, that is a shift. If it is the trend is again something that is normal. Okay, a change of 5 points up or down, that is a trend. It usually happens. Okay, shift is something is changing. Okay, and astronomical data is some unexpected change. Okay, so this is how run chart can help you in the beginning of the project, if the project is moving smoothly or not. Okay, if you are only getting this trend, things are moving smoothly, there is not much delay. Okay, if there is a lot of shift and lot of astronomical data, something is wrong with the process. You have to recheck it. Then you have the control chart. Control chart is also a type of run chart, but it has control limits. Okay. Upper control limit, lower control limit. On this chart, you can see. Okay. This red color dotted line, these are the limits. The data points should stay within this limit. If any data point crosses these limits, okay, either upper limit or lower limit, okay, if any data set that you have observed is out of the upper limit or below the lower limit, that data is called out of control point, special cost variation. It is not normal. Something abnormal has taken place. You will have to find it out. Okay. Common cost variations, you will not get the same number again and again. There will be difference in the number, but all those differences should stay within the control limits. Okay, that is common cost variation. These are variations that usually happens, you are prepared for it. Special cost variations, you are not prepared. Randomly, once in a while, it takes place. That's control chart. Then you have process sheet. Process sheet is also a managerial tool, but from the name itself, you can understand process sheet will list down each and every production process or manufacturing process or service process. Who is responsible for it? What has to be done? Okay, at by what time it has to be done? All these details will be mentioned, because if there is a big process taking place, one person is not responsible for the entire process. There would be a team responsible for specific segments of the process. What is a process? Process is a step-by-step instruction. Okay, step-by-step instruction. Each step, there could be somebody who is responsible for it. Okay, so in process sheet, step by step, you will not start the process sheet with last step or middle step first. Okay, process sheet, the step name will also be in the order in which it has to be done. Okay. So it is a document that provides all the steps of manufacturing products. Okay. And usually professionals will use it to ensure that each step in their workflow is appropriately completed by whoever is responsible. It even instructions for a specific batch, a lot, or a run is also mentioned. What all equipments are required in this process, where it has to be done, what facilities will be used for this process. All this information will be mentioned. Then you have the Gantt chart. Gantt chart, similar to process sheet, but the name of the equipments and all is not mentioned here. Okay. It allows managers to map out a project plan. Okay, by organizing each step of the project in such a way that the start date, end date, and who is responsible can be evaluated from the Gantt chart. Okay, every project will have a step from planning, research, design, implementation, follow-up. Okay, all these are steps of a project. From when it has to start, when each step, okay, each step, when it has to start, when it has to end, who is responsible. Okay, all these things will be mentioned in the Gantt chart. So everyone will be aware of their task, when it should start, by when it has to end. Okay, how to work collectively for the completion of this one single project. For that, Gantt chart is used. Then PERT chart. PERT stands for Project Evaluation and Review Technique. Okay. Again, process step by step, when to do, by when it has to be completed, each step, When should it start? When should it end is mentioned. But the difference between Gantt chart and project chart is how steps are related to each other is shown in PERT chart. In Gantt chart, the only relationship you can find is which is the first, which is the last step. Nothing else you will find. If there is any delay in the design phase, what will happen to the implementation, what will happen to the follow up, you cannot predict. Okay. But in PERT chart, if there is any delay in any of these steps, okay, how it will affect the coming up steps, will it be delayed or will it not be delayed, can be understood. For example, if I ask you a question here, release prototype is a step, okay, of this process. If there is a delay, okay, there is a delay in this step, will it affect publishing the tutorials? You can answer in the chat box. If there is a delay in release prototype step, okay, will there be any effect on published tutorials? You can answer in the chat box. There will not be any delay, okay? Because if you see the arrows, no way the arrows from release prototype is related to published tutorials. Okay. If there is any delay in release prototype, testing the hardware, release of the hardware will get delayed. Nothing else will change. Okay. Release prototype and published tutorials have no relation between each other. They are not joined towards each other with respect to the arrows that you see here. The arrows are significant. They will show you after doing release prototype, what should come? Testing the hardware will come. Okay. And if there is any delay in the release prototype, definitely testing the hardware will also be delayed. Okay. So this is the PERT chart. The date, time period, and date you see, to date, it is the start date, how long it will take to finish this task in days, and end date. Okay, these two dates for each step is mentioned. One date is the start date, one date is the end date. Okay. Then we have the decision matrix. So decision matrix will help the managers understand how much task they have to complete. Out of that, which task is important, okay, by when it has to be completed, which task is important, which task is not important, okay, which task they have to delegate. Delegate means help tell others to do it. Okay, so all these decisions can be made using decision matrix. It basically helps the people, managers, okay, to take the decisions. So that is decision making matrix. Okay, there are different kinds of decision matrix. Here you can see the one that I've shown you on screen. There are rows and columns of urgent, not urgent, important, not important. Things that are urgent and important, you have to do immediately. Okay, right now it has to be done. Today itself it has to be done. Things that are important but not urgent, schedule it so that you will not forget it because it's important, but right now you don't have to do it. You have a time slack. Okay. Things that are urgent but not important, delegate it. Let somebody else handle it. Okay. So your time you can focus on important things. Not urgent and not important, delete it. No need to do it anymore. This is decision matrix. Okay. Any doubts here so far? If you have any doubts, you can mention in the chat box. Then you have the force field analysis. So force field analysis, you have to identify two forces. When you make a big decision for your company, your employees will not be happy about it. Not everyone will be happy about it. Some people will be happy, some are not happy. Okay. So some people are your driving forces, some are your resisting forces. Okay. Driving forces, why people are happy. Resisting forces, why people are not happy. Everyone will have their reasons. So you list it out. You make two columns, you list it out. Okay. You take a voting, who is interested, who is not interested. Everyone who is interested, they will give you the reasons why they are interested. Okay. So all those things will come on the driving forces. So you can see here better patient care, reporting, clinical governance, research, okay, assessing the data quality. All these things are reasons why your workers may be supporting you, supporting a new decision. In resistant forces, you will see why people are not supporting. Okay, they don't want to change. They don't trust computer. Okay, they may feel they will have to spend more time. Okay, they fear they are not competent for something, a new change. They may have to learn something. Okay. So these are resisting forces. What you have to do with the data that you get from force field analysis, you have to reduce resisting forces as much as possible. Whatever problems you see here or the resisting forces, you have to solve them. You have to rectify them. So the number of resisting forces becomes lesser and lesser. The number of driving forces are much higher. So it is easier to make a strategic change in the hospital. Okay. So we'll stop the class here today. If you have any queries, you can mention it in the chat box.